Are your eyes red and painful? Do you have dry eyes? Have you tried all of these drops without finding relief? Well, you're not alone. Over 20 million Americans suffer from dry eyes. Today, we're going to go over 3 tips to take care of dry eyes. By the end of this video, you will have easy lifestyle hacks, great over-the-counter solutions, and even go over one of my preferred prescription medications to tackle stubborn dry eyes. So, let's begin. First things, the basics. How are red eyes and dry eyes related? Fewer tears causes damage and inflammation to the ocular surface of the eye. This damage can cause your eyes to become red and irritated. Dry eyes cause a variety of symptoms. In addition to redness, my patients report to me that they have blurred vision, eye pain, and yes, even tearing. Tip number 1, make quick changes. These are what I call my lifestyle hacks. The first thing I recommend is what I call the 20-20 rule. Every 20 minutes, take 20 short seconds to look at something 20 feet away. By taking breaks, you minimize eye strain and you blink more. This pushes what tears you have to give you quick relief. The second thing I recommend is keeping a humidifier near the area where you spend most of your day. If you work from home like many of my patients, keep a humidifier in your home office. By increasing the moisture in your home office, it prevents tears from evaporating. Tip number 2, start with the right treatment options. There are many excellent over-the-counter options. In fact, one of my favorite things for dry eyes is using preservative-free artificial tears. It's important that they're preservative-free. And the good thing is there are hundreds of amazing brands out there. The one thing I don't like is those get the red out eye drops. Many of these eye drops work by constricting the blood vessels around the eye, and they don't address the underlying cause of dry eyes. Tip number 3, you might need prescription strength medications. Sometimes the lifestyle hacks and the over-the-counter treatment options aren't enough. You need to address the inflammation. CEQUA is one of these prescription medications designed for this situation. The ideal treatment for any issue has to be quick, has to be comfortable, and has to address the underlying issue. And CEQUA directly addresses inflammation. Inflammation is one of the underlying causes of chronic dry eyes and plays a role in disrupting the tear production. CEQUA works fast. Eye doctors like myself can see improvement in the signs of dry eyes as quickly as 2 weeks. There are other prescription medications out there that may take several months before we see improvements in the signs of dry eyes. And finally, CEQUA is comfortable. This is one of the most important factors that I look for in my clinic. If the treatment hurts, I know that my patients won't take it or won't stick with it. In a clinical trial, 97% of patients who started with CEQUA stayed with CEQUA. And so, those are 3 tips to take your eyes from this to that. For more information about dry eyes, take a look at this video right over here. And of course, I also want to thank the sponsor of today's video, the makers of CEQUA. Thanks for watching. We'll see you in the next one. Hey everyone, thank you again for watching. Let's go over a couple key things about CEQUA. The most common side effects that may be experienced may be eye pain after administration drops and eye redness. Other side effects reported may be eye irritation, eye inflammation, headaches, and urinary tract infection. For any other questions, talk to your local eye doctor. Again, thank you for watching. We'll see you in the next one. Thanks guys. Bye.